And for more, let's bring in board-certified obstetrician gynecologist Dr. Greg Marchand. Dr. Marchand, thank you so much for joining us. Obviously, a very, very hot topic here. I want to point out something that you said that I think is very important. Katrina said it as well. You had said no causal link has been established. These are observational correlations, not proof of direct causation. Explain what that means.
Right. So as you pointed out, there's a lot of data that's come out about the association between Tylenol and pregnancy and autism. But this is what we consider lower level evidence. These are observational studies. So these are studies that are either going back to look at medical records, or these are going to be studies where they're giving surveys. They're observational studies. They're not the gold standards that we really like in medicine, where you're doing a prospective randomized control trial to get the real hard data. So at this point, we know there's an association between mothers that took Tylenol during pregnancy and more of their babies born with autism, but we haven't proven the causality. We haven't proven that the Tylenol itself is the thing that's causing the autism, and that it's not whatever reason the mother was taking the Tylenol for in the first place. That's why it's so wonderful that the NIH is going to go ahead and put a lot more funding into finding out the causes for autism. That's really wonderful. As you probably know, just a few years back, there were billions and billions going for research in DEI and gender affirming care. But now, even if we're not successful, it's just such a wonderful thing to look into what could be the cause for all these babies born with autism.
Excellent.
Doc, why do you think the Trump administration went with this then?
I think it had a lot to do with RFK's influence about keeping America healthy, and I think it went with it very honest and a very sincere passion for helping children and finding out why 1 in 31 children now is being born with autism. And what a horrible thing. So I think it's wonderful. The Trump administration, RFK, and of course, Jay Bhattacharya that's taken over the NIH are going to focus on this, and they're going to do everything they can to get a solution, because this is one of the biggest problems in America. It's time to turn away from social issues and kind of soft research. The NIH is back at work, working for women, working for babies, and working for America.
Yeah, let's get some science done. Also, let's share your advice for pregnant women, because I mean, we saw the crazy TikTok video of rebellious people downing Tylenol while pregnant, which is preposterous to me. But also, there's no need, I'm assuming you will agree with me, for people to freak out if they need to use Tylenol while pregnant for whatever health reason they may be experiencing. You say what?
Absolutely. Don't panic. If you've been taking Tylenol, the risk is very small. If you're able to get by without the Tylenol, if it's for aches and pains of pregnancy and you're able to get by with things like heating pads, rest, and warm baths, go ahead and do that. Talk to your OBGYN about what else you can use. For most women who are less than 28 weeks pregnant, you will be able to take ibuprofen, 600 milligrams every 6 hours if you are less than 28 weeks, but certainly discuss that with your OBGYN. Of course, there are some conditions that are still going to require Tylenol. We have no good medications for third trimester fevers, with the exception of Tylenol. So that's going to be one, as President Trump's pointed out, that we're still going to need Tylenol for. But if you can stop using it, especially if you're using it for aches and pains of pregnancy and that horrible back pain in pregnancy, if you can stop, now would be the time to talk to your OB-GYN.
Yeah, use it as little as possible while pregnant there.
But don't panic.
Yeah, all right. Dr. Greg Marchand, sir, it's a pleasure.
Thank you very much.